All right, so for next complication in pregnancy, we should be looking, not really a complication of pregnancy, but it's a disease condition. Do you understand? So if it occurs alongside pregnancy, pregnancy is something that demands a lot of, it stresses the woman a lot. So if you're having pregnancy and so you're also having diabetic insipidus, we're trying to look at possibly how these conditions will coexist. The effect they will have on the mother, the effect they will have on the baby. So diabetes insipidus, is just something that it has to do with the ADH hormone. So ADH hormone is antidiuretic, anti against, diuretic formation of urine. So it's a hormone that would make the kidneys to reduce formation of urine. Most of the times is when your water levels in the body are little. So this hormone will now go and stop the kidney from making too much urine or diluted urine, so you have concentrated urine so that it can preserve water in the body. But if you have this hormone deficiency, or maybe this hormone is being released but the body is not responding to this hormone, then you have the body making too much urine. Now that's what is called diabetes insipidus. So it's just a rare, alright, that's you having it in pregnancy is rare, alright, but it's important condition to recognize. Okay, it's distinct from diabetes mellitus and involved impaired water balance. So for this one, water is not balanced, So the pregnancy specific form is called the gestational diabetes insipidus. Okay, so what causes it? So placenta produces an enzyme known as what? Vasopressinase. Now that enzyme is an enzyme that even if the antidiuretic hormone is released to go and stop the kidneys from producing dilute urine, the enzyme will go and break it down. So it leads to what? Urine not having something to control its formation. So there's too much urine. Alright. So as you are losing urine, you are testing. Okay. So it typically appears in the third trimester. It will resolve 4 to 6 weeks after you give birth. So usually a problem of that's gestational diabetes insipidus. Usually like a complication of pregnancy. So risk factors is if you have so many babies, twins, triplets, if you have liver issues, okay, leading to hypertension or hemolysis, elevated liver enzymes, then low platelets. Okay, if you had diabetes insipidus before getting pregnant, okay, so symptoms is what? You are urinating so much, that's polyuria. Okay, as you are losing water, you want to take more, that's what? You are testing so much, that's polydipsia. Then the urine you are producing is not concentrated because there's no antidiuretic hormone, so you're having a dilute urine. Then you are losing so much water, so you are dehydrated, you are weak, you are pale, and all of that. Diagnosis I want to do for blood test to check out for antidiuretic hormone levels. I want to do urine test to look at my urine color, and all of that, to look at the amount of urine produced and all. The MRI, you want to actually rule out any issues to the pituitary gland, right? Then water deprivation test. So treatment is I want to give the patient a drug that is similar to what? Antidiuretic hormone. So this will help to pause that excessive loss of water. So a blood that has been made like antidiuretic hormone. Now know that antidiuretic hormone is also known as vasopressin. So this drug is known as desmopressin. Then hydration monitoring. Okay, so just try to monitor the patient as they are losing water. You are giving them, but not excessive and all of that. Okay, so this is this disease. If it occurs in pregnancy, this is how it should be followed.